antibody deficiency, or PAD, is the most common inherited immunodeficiency. These patients suffer from persistent infections as well as a higher prevalence of autoimmune and gastrointestinal disease as a result of immune dysregulation. These complications are difficult to treat and result in early death in patients. Presently, optimal therapies are lacking for these patients as the genetic cause of disease is unknown for the majority of them. The aim of our research is to identify the genetic causes of disease and determine how this affects the function of immune cells. This will increase diagnosis and enable targeted treatment of patients, which will then improve patient quality of life and decrease the rate of early death in this population. Using samples from patients, our research uses state-of-the-art whole exome sequencing to identify the genetic mutations that cause disease. Once identified, we then look at the function of critical immune signaling pathways known to be important for adequate function of the immune system to understand how these mutations affect immune function. We do this by looking at the number of different immune cells and their function on a single cell level using flow cytometry. Identification of a genetic mutation that affects immune function will enable a confirmatory diagnosis to be made. This will improve the diagnostic rate of PAD patients and give patients access to personalised treatment, which is required for optimal treatment as well as to prevent early death. Of note, as we have a focus on the impact on immune signaling function, if function is shown to be altered, it would provide a rationale for drug repurposing in these patients.